Here. Is this on? Testing? It's working? Great. What do you think? Should we go? Yeah. All right. Guys, it's February right now. Unbelievable. It's so good to be here on this sunny, beautiful day at Mercy Center. My name is Kate McKenzie, and I'm the Executive Director of the Mayor's Office of Food Policy. I want to acknowledge and thank our hosts, Marianne and the whole team here at Mercy Center. We know that the work you do here is clearly so essential to this community, and it is so amazing to witness it firsthand, and really the value of your volunteers and your staff cannot be underscored. That is just so amazing. We're here to celebrate today. What we're here to celebrate is the result of years of advocacy and partnership. Efforts from advocates here in the room like Bronx Health Reach, CUNY Urban Food Policy Institute, the Food Bank for New York City, City Harvest, West Side Campaign Against Hunger, and of course with the support of funders like the Robin Hood Foundation, Helmsley, and the New York State Health Foundation. It's great to see so many of you here, and I want to especially acknowledge the support of those who couldn't be, including the Coalition for Good Food Purchasing. I also want to acknowledge Borough President Gibson. I'm so happy you're here. Dr. Michelle Morse from the Department of Health and Mental Hygiene, the Chief Medical Officer and for the Center for Health Equity and Community Wellness. Thank you for all of your leadership. But all of that got us to this particular moment. But we are now at the cusp. We now have a real leader in the form of Mayor Eric Adams, who's going to take us to the next level. A mayor who brings his personal experiences to bear in making sure that all New Yorkers are empowered with the information and access needed to eat healthy, nutritious food and live their healthiest lives. It is now my pleasure to welcome Mayor Eric Adams to say a few words.
Thank you so much. Health is wealth, and it's a transitional moment because many of us are afraid. And, you know, when you start talking about pushing back on things that we were told were healthy just to find out they're not. And food is more than what you eat. You know, I would lose a baseball game and Dad would give me a chocolate cake and a cupcake. And when people started talking about, you know, your dad shouldn't be giving you that, I was ready to fight them. You know, you're attacking my dad. And so if we don't factor in the cultural norms that's attached to food, then we'll never make this transition in a smooth way. This is not about dictating it to people. We're meeting people where they are and taking them where they ought to be. When you show up here at a pantry, you are really at the end of your rope. And when you come here asking for help, we should not be giving you the food that feeds your health crises. The numbers are staggering in the Bronx. The health care crisis we have here is being fed by the food in our schools, in our hospitals, and everywhere government is feeding you. And so we have the audacity to say this is not right. This is not right. As a child, when my mother went to get food to feed her 6 children, that they were giving her over-processed cheese. They were giving her powdered milk, powdered eggs. They were giving her canned meat. Little did she know that was going to feed her diabetes, her heart disease, her arthritis. And so we are just bold enough to say this is not the legacy that we're going to leave. That food has life. Do me a favor, hand me that cucumber for a moment so people can see. This is life. And when you give food like this out, Mercy Center, you are saying to the people of this community, We love you and we respect you. You deserve what they have downtown. They're not giving canned meat on the Upper East Side. They have some of the best food. So why can't you have some of the best food? And you have a mayor that's saying he's not going to listen to the noise of those who are saying you don't deserve it. He's going to say you deserve it, and we're going to deliver it. That's what you deserve, and that's what I'm going to do for you as the mayor of this city. And so I'm proud to be up here today at Mercy Center. As soon as I saw you, you said what? I got to bounce. You know, you know, and I'm here because I'm also happy to be here with Commissioner Jenkins, who I just spoke with you for what, about 2 years, about your vision, now having you part of the team. And today we're signing 2 new orders for the city of New York, but the procurement process now is going to start including fruits and vegetables for the first time in the 30-year history of the program. This is a huge win. It's a huge win for all of us. And Kate, you know, your vision, pushing this forward is just so important. And Mercy, you know, have mercy on us. You know, because we're going to get it right. So going forward, the City Emergency Food Assistance Program will provide a consistent supply of nutritious food to more than 600 providers that are providing for thousands of families in the process. We're making changes like this one to reduce diet-related health inequities and outcomes. On Monday at Kings County Hospital, we rolled out our alternative medicine and plant-based initiatives. We rolled out on Fridays, meatless Fridays, and healthy food choices. And you know what? Eric, there were bumps in the road. Yes, so what? We're going to get it right. We're going to get it right. So that's what we're going to do. And so today I'm here to talk about what we're doing upstream, ensure that our government does not continue to feed the chronic diseases and crises. 2 executive orders. First, updates and reissues the food standard across all city agencies and formalizes the city's commitment to the Good Food Purchasing Program. We spend almost $500 million of your tax dollars, and far too often those dollars are spent on unhealthy food. Got to move in the right direction. We're going to use your tax dollars correctly. And that means in our schools, prisons, juvenile detention facilities, public hospitals, homeless shelters, and child care centers. And then we want to encourage people to understand the correlation between healthy food and our environment. No one talks about the overconsumption of beef and meat, how it produces the greenhouse gases that we're fighting against. So we got to close that gap and engage in that conversation. The second order will provide transparency, but how food is purchased and impacts local economies, environmental sustainability, workers' rights, animal welfare, and nutrition. And I'm committed to ensuring that government, particularly this administration, is doing its job in these areas. And finally, we're going to sign an executive order today. This is one of my favorite ones, to ensure advertisement and promotional materials from every city agencies must promote healthy foods. We cannot continue to promote unhealthy, sugary drinks, fast food, fat contents, overprocessed food that creates our healthcare crisis. Even the birds are singing my praises for making this happen. 11% of adults in New York City consume no fruits or vegetables. 11%, no fruits or vegetables. 2% of adults consume sugary drinks daily, feeding their crisis. And so nutritional equity and food justice go hand in hand. By changing the way New York City promotes and advertises healthy food, we are empowering New Yorkers to do the right thing and put them on the right pathway. I'm excited about today. Promise made, promise kept. I said this on the campaign trail. I said we're going to go after the food. We're going to go after the food insecurity. We're going to go after the bad food in our community. That's the promise I made. That's the promise I kept. I promised we're going to change school food. That's the promise I made. That's the promise I kept. I said we're going to expand lifestyle medicine in our hospitals. That's the promise I made. That's the promise I kept. I'm going to make the promises, but most importantly, I'm going to keep the promises. And today is another promise we met. And I cannot thank Mercy Center, all of your volunteers for being out here and providing the love through nutritional food. Let's continue to do so. Great job, Kate, and your entire team.
Thank you. Thank you so much, Mr. Mayor. Thank you so much. And, you know, one of the big announcements is that Mr. Mayor mentioned was that the Emergency Food Assistance Program will be ensuring that fresh fruits and vegetables are part of the regular stream of food coming across the city. This man here, Mr. Gary Jenkins, Commissioner of the Department of Social Services, is going to make that happen. I have had the extreme pleasure of working with Gary, and I know firsthand his commitment, his personal commitment and his professional commitment to health and wellness. Welcome, Gary.
Thank you. Thank you, Kate.
All right.
Good afternoon, everyone.
Afternoon.
Thank you all for joining us today, and thank you to Mayor Adams for convening us together to discuss the administration's commitment to procuring, preparing, and serving healthy and nutritious food to New Yorkers across the city. We all know that a nutritious diet is one of the keys to a healthy and prosperous life. And oftentimes, New Yorkers experience challenges accessing healthy and nutritious food. To that end, rethinking our city's approach to food justice requires bold and tangible actions. And as the mayor has said, if we want to encourage New Yorkers to be healthier, the city must set the tone. Today's executive order will ensure that agencies across the city provide healthy food options to New Yorkers we serve, including some of our most vulnerable residents. By providing our communities with healthy food options, we can more effectively help reduce diet-related health inequities and diseases for all New Yorkers. In addition, I am also excited to announce today the official release of DSS HRA's new food distribution program procurement for our Emergency Food Assistance Program, EFAP. EFAP is an existing program at DSS HRA that purchases and distributes food to close to 600 food pantries, soup kitchens, and community organizations throughout the 5 boroughs. This important program proved to be a vital lifeline for many New Yorkers experiencing food insecurity during the pandemic. And we are excited to continue building our progress to reach even more of our neighbors. And starting today, is codified in our new RFP for the program. We will now require our vendors to distribute fresh fruit and vegetables to all of these important organizations, ensuring that communities have access to healthy and nutritious food. A personal note, I'm the youngest of 8 kids, born and raised in Brooklyn, still starts with a B. I know I'm in the Bronx. Still know that. But, you know, my family, we grew up on cash assistance. It was a struggle. And like the mayor said, we were that family in line getting that unhealthy food, right? So today, under Mayor Adams' leadership, we're changing that direction. We care about New Yorkers. We care about those families so that way we can grow and be a healthier city. So Mayor Adams, thank you so much.
Thank you, brother. Appreciate
All
you,
right.
man.
I think we're going to do some signing.
Yes, but before we do signing, we can't be in the BX without the BX ball president. You know what I'm saying? We gotta bring on.
Good afternoon, everyone. Thank you so much. It is really an honor and a privilege to be here at Mercy Center with our Mayor, Eric Adams, with our Commissioner, Gary Jenkins, and our Director, Kate McKenzie. As someone who is a strong supporter of achieving food equity and food justice and reducing food waste across the city of New York, today's announcement is going to take us a step in the right direction. I first and foremost want to recognize the incredible staff at Mercy Center. Thank you for saving lives every single day. To the volunteers and all of the staff that come here every single day, you provide hope for so many residents that feel hopeless. You give them an opportunity when they feel that government has failed them. And it is our job to support the work here at Mercy Center, but also all of the work that's happening across the Bronx and the city of New York. Our food pantries and soup kitchens are hubs for New York's families, for working families, for families that are living in temporary housing, for vulnerable families and immigrant families. And today's announcement affirms our commitment to make sure that no family should ever go to bed hungry. In the greatest city in this country, whether it's achieving universal free breakfast, universal free lunch, supporting our food pantries and soup kitchens. Commissioner Jenkins knows that my heart has always been with the EFAP program. As a member of the City Council, we pushed to make sure that the EFAP program and the HIPNAP program in the state were sufficiently funded so that we could support this incredible mission. And working with Kate McKenzie and the Mayor's Office of Food Policy, very proud to have been the prime sponsor of Intro 1664, which is legislation we passed in the last 2 years during our time in the council that will mandate the city to come up with a 10-year food policy strategy. And all of these efforts, plant-based diets, health and wellness, health is wealth. And we know that we have the ability to create the access and the opportunity that every family needs, no matter where you live, no matter what zip code you live in, what language you speak. You deserve access to healthy food. And I also want to add another critical partner in this work, our supermarkets, our grocery stores, and our bodegas. We need to make sure that we are investing in programs like Health Bucks through the Department of Health and Healthy Bodega initiatives, working with Bronx Health Link and Bronx Health Reach. Not 62. You all remember, we're in year 6. Not 62 is not just a hashtag, but it's a transformation. So we are no longer the last in everything that is good and first in everything that is bad. We have to turn these statistics into success stories. And with leaders like Mayor Adams, Commissioner Jenkins, and Director McKenzie, we will get stuff done. So I thank you for being here. Looking forward to working with you.
Love it.
Thank you.
We sign before we open up to the favorite part of the press conference, answering the questions of Gloria.
Shouted you out, Gloria.
No New York team is in, so yes. Gary.
Healthy food, New York City.
She can come in and join. Come in and join. Come get in this picture.
Yes, Dr. Morris.
Yes. Get that picture.
Okay. All right. Topic first. Let's start with Michael. I'll take it off. You get off? Okay.
Michael, you know Michael's always an off-topic guy.
My question is, could you give us some examples of the food that's available today before you sign the order that will not be available going forward? And some of the new food that currently is not available that will be introduced as a result of this order. And my second question is, does this affect the DOE?
You guys,
I'm happy to jump in. Thank you for that question. You know, part of the Good Food Purchasing program is about tracing where our food comes from. We go to the grocery store, we can figure out where, you know, these are from California, these are from Florida, this is from New York. We want to know that we're buying apples from New York. So we're still going to buy apples. We're just going to make sure that they're coming from New York when we can make sure that they're coming from New York. And it absolutely applies to the Department of Education.
and you know, part of the previous administration, due to our encouragement, you know, moving towards a 50% purchase and beef reduction. We want to continue to encourage that. Moving away from processed meat purchasing in our schools and in our government, which is a type 1 carcinogen. So we're going to continue to evolve of how do we use taxpayers' dollars in a smart way to purchase healthy food.
You're going from, you know, canned meat, which might take a little longer to go bad, into some of these foods, which are healthier but are more perishable. And we've seen some quality control issues in terms of the vegan Fridays at school. So what are the QC issues gonna look like in this program to make sure the food that gets here is still good?
And listen, that's part of the process as we make this transformation into a healthier lifestyle. And I think that's where we went wrong. We were focused on caloric consumption and not nutritional consumption. And so, yes, if we have to pay a little more to make sure that these perishable items are available, that's a better investment. We have been paying less on the front end and paying more on the back end. We're going to turn that around. And the more and more we do it, the more and more we're going to get it right. The more and more we're going to encourage vertical farms in our schools. There's no reason children can't grow food on their rooftops and bring it down to the cafeteria and serve it. We're going to encourage having, those greenhouses where you can grow food. So now we're opening a whole new economy by growing locally and making sure we can get it right from farm to table like other countries and other cities and states have started to do.
I think to follow up on Liz's questions, I think what I'm trying to get clarity on, if you have been relying on a pantry, and that pantry has been giving you, let's say, cereal, are you no longer going to get that kind of, are you not going to get that anymore? Now, are you only going to be getting this, or is the idea to add more of this and not necessarily take away?
Sure. Remember, we know that there is a lot of important food requirements to help make and give us nutrition. Healthy fruits and vegetables are one part of that. In addition, the program at DSS also provides, and we've got some recipients here, really good quality. Not everyone can take fresh food, so there will still be, within the New York City food standards, canned fruits and vegetables. There will still be grains. My goodness, New York is also an incredible grain state. Grains and beans and oatmeal. All of those products are incredibly important and will continue to, this is additive. This is not, we're not taking anything away. We're adding incredible amounts of quality and variety to the emergency food system.
And then we want to build out, I'll never forget, as I said earlier this week, going handing someone a beet and they say, what's that? We want to build out and show people how to cook plantains, how to cook squash. People don't know how to cook that. I had to learn how to cook these things, so we're going to do cooking classes. We're going to ensure that in the schools learn how to make these great tasting meals. That's the role we must play. This is a new day, and the fearlessness that accompanies having a new day, we're going to subside that. There's a lot of reasons people are going to say, no, it can't happen, it can't work. Let them say that. We are transforming how we feed people in our city.
Okay, having been a former produce manager and former Parents Association president, I could tell you about the food in the schools.
Yes.
It is the worst food, the smallest fruit, the smallest vegetables, the worst food. However, you must abide by the lowest bidder. How are you getting around that?
And it's so important. This is allowing us to start the conversation of those things you are talking about. When I campaigned and I stopped at schools and children pulled me over and said, this food is disgusting in our school, can we do something about it? And so because now I am using my platform to shed a light on this, now all of my agencies are going to look at how do we make the process better? How do we get the best food? How do we use a different equation? Not just the lowest bidder, but the quality that we're looking for. This is the beginning of a process and a conversation, and it's not going to happen overnight. You don't grow a banana in a day. We are in the process of getting it right, and we should be encouraged that we're getting it right. 70% of 12-year-olds have early signs of heart disease. That's our #1 killer. And no one seems to care. I care. Subject.
I'm wondering in terms of like food deserts and neighborhoods like this, that or ways to help increase like commercial availability of food for people who maybe
great question. We need to be creative. I love the food bucks. You know, you spend $2 on something at one of the green markets, they match it with another $2. And part of our plan of using the digital wallet, we're going to use incentives. If you are on SNAP, you buy healthy food, we're going to match it in a digital wallet. If you are on WIC for your child, if you buy healthy food, we'll match it. So we're going to encourage and incentivize bodegas, local bodegas, to carry healthier foods. We're going to expand our green market. Do you know that NYC is not allowed to have a green market? That's unbelievable. When you look at the health crisis in NYC and they can't have green markets, that's over. That's over. They will be able to have green markets. We're going to identify the locations. The policy must meet the necessity. And so we're going to encourage access to healthy food. And now we have a real crisis around retail spaces. So why not use those retail spaces and turn them into useful places that we could expand what they're doing here? That's what we must do. We must push the agenda forward of access to healthy food. And then we need to show the affordability of it. New York One took my recipe of meatless chili, fed 4 people on $11. You know, so we're going to encourage and like you said, Jeff, we have to have access to this healthy food.
Okay, so let's do a few off topic.
Okay, you guys can bounce. Y'all don't want to be here for this. Trust me. Well, tell them what they can do.
I'll tell you now. You can bounce.
Yes.
Thank you.
All right. Good to see you.
The cooperatives too.
I want to talk about that.
Yeah.
Okay.
This is kind of a softball.
You don't give softball questions, man.
You know, there'll be promises made, promises kept here. The speech you gave us a rousing speech at breakfast this morning. So I want to ask you about, another kind of substance. Like, can you talk a bit about your spiritual life, like your spiritual upbringing, like people that have influenced you spiritually, like, and how you kind of, direct that into your public life?
Listen. And Gloria, you have heard me say this over and over again. I am not here because of my skill set. I'm here because of the power of prayer. People have prayed for me. When you look at the anatomy of my life, when you look at a young man dyslexic, didn't want to go to school, arrested, a young man that had to study harder than everyone else, running in this race. You all saw this mayoral race. You saw how challenging it was. People who have known me for years, all of a sudden forgot about my history and police reform, criminal justice reform. All the odds were against me. It's only the power of prayer. And that prayer I got from my mother. My mother took us from a rat-infested 4-story tenement building on Gates Avenue, and she said, baby, we are going to go to Queens in a house. And I watched her pray all the time. I wake up in the morning, I pray, I meditate, exercise, green smoothie. I start my day with prayer, I end my day with prayer. So that was not a speech. That was an analogy, an anatomy of my life journey. I'm here because I can walk down the block and people will stop me and place their hands on my shoulders and pray. These folks have been praying for me for so long. And they know what I'm talking about the power of prayer. You start the month out not having enough money to pay your rent, and somehow you find it. That's prayer. And so mother was able to hit the numbers. You probably don't even remember numbers. Mother was able to give people a handout food for us. I didn't even know what clothing was new, and because people just gave us clothing from the neighbors on the block. Prayer has sustained me, has motivated me, and I'm bringing that prayer into my city because we lost the power of prayer. I just believe in the power of prayer.
Amanda first.
Good afternoon, Mr. Mayor. How are you?
Quite well, Amanda.
I unfortunately don't have a softball question. So I was wondering if you could explain some of the changes that you've made to the city's org chart, specifically around why the NYPD will report directly to you instead of Phil Banks, why the housing portfolio won't be with the deputy mayor, and why the Office of Labor Relations is under your council instead of the deputy mayor?
Well, okay, first, we've never had a deputy mayor of public safety. Police commissioners always reported directly to the mayor, always. Chancellors always reported directly to the mayors. You know I ran on public safety, and it's imperative that my commissioner reports directly to me. The role of the deputy mayor of public safety is to do something we have never done before, is to align all of our public safety apparatus. We have hospital police. We just had a shooting in the hospital. And the hospital police personnel, they're not even clear on their real mandate. We want to align our school safety agents. We want to align our homeless service police. So the deputy mayor of public safety is going to align our entire public safety apparatus, and we're going to move as one unit. The police commissioner is going to run the police department, and she's going to report directly to me. And I continue to say, I'm just so happy that I picked the right police commissioner. And so we're moving around the org chart based on my analysis of how to better run government. Can we do something? Can we let these folks get their stuff? Yeah, let them flow. Don't worry about that. Listen, they gotta. You get your stuff. Come on, get your. Yeah, I'm gonna help you. But in the meantime, I don't want these people waiting online. I'm gonna lose votes. They're waiting online. So I'm looking at the org chart, and we how you doing, Queen? I'm moving around. We're moving around our org chart based on the needs, and we're going to adjust it based on the needs. I'm not going to be stagnant. I'm not going to say, well, this is traditionally the way org charts are. I'm going to be flexible and find exactly the way I want to do so.
Just trying to figure out what's the best fit, so who's the reporting fit?
Based on my, everyone would tell you that my skill set is structure. And I know when it's right. And I'm willing to change structure if it's not right. And right now, we know this for sure. Let's be clear on this. We know that our housing policy has not produced a product that we need. We know that we've been failing in education. We know that we have not been producing the product that New Yorkers deserve. And so I'm going to continue to move and shift until I get the right combination that I know we're producing the product that we deserve.
Do you have any reports or any way to analyze whether or not it's effective?
Yeah, they'll come to me. My team is going to give me the report. You need to see the finished product. That's what we should be more concerned. Eric, what's the finished product that you're going to give us as New Yorkers? Everybody wants to see reports. They want to see things analyzed. You need to see the product. My children are educated. My streets are safe. We're building housing. We're dealing with a mental health crisis. I'm going to give you the finished product that you deserve.
Okay, we're going to have to wrap. So we need Matt and then Jeff, and we got to wrap. Sorry. Mr. Mayor, how are you doing?
Good. How are you?
I'm doing okay. Thanks for asking. Regarding the indoor mandate for restaurants, gyms, etc., what levels, at what metrics, over what period would those have to go down to for you to consider dropping?
Right.
Do you have a level?
Right.
And I know you're going to listen to the science and the data, but what do you decide?
Matt, I want to get rid of these darn masks so bad. You know that? I want to get rid of, I will continue to say vaccinate, booster shots. But every morning I listen to the doctors, and the doctors give me, Eric, this is exactly where we are and what we need to do. Here's my biggest fear. We prematurely get excited and say, let's just, throw caution to the wind. I don't want the city to close down again. The discomfort of wearing the mask for a short period longer, I'd rather live with that than prematurely say, let's just get rid of them, and now we're right back to where we started from. So I want to err on the side of caution. My healthcare professionals have not said this is the moment yet. We're looking at some things that we're going to roll out. I support what the governor has done. I want to get the city up and operating. And I'm sure we're trending in the right direction, and we're looking forward to having folks not walking around with masks.
Regarding the vaccine numbers, do you have a number where if you get to a certain level, a certain sustained period, where we'll drop the vaccine mandate for indoor premises? Do you have a number in mind?
No, the doctors would tell me. They give me an exact number. I'm proud that we're at 75%, but if they give me a number, and I'll ask that question, and I'll let you know directly. But if they give me a number, that's fine, but I'm sure knowing them, because they're very conservative, they're going to say 100%, you know. But no, we believe we have to get the city up and operating. We're trending in the right direction. We should be really proud of ourselves as New Yorkers. Difficult challenge. Look at what's happening in Canada. People are so angry about what's happening in Canada. They're blocking the bridges because they feel as though they're being restrained. But we're being responsible, and we're still able to enjoy our lives.
Tomorrow is the deadline for city employees to get vaccinated, and I know there's possibly 4,000 workers who haven't met that deadline and could be terminated. I'm wondering, are you going to allow the terminations to happen tomorrow, and do you have any idea how many city workers remain unvaccinated? Well,
you know, what we learned that some city workers were vaccinated, and it just hasn't been updated yet. We're receiving those following numbers. We're receiving those following numbers. So we learned that, you know, we want to make sure we have current numbers, and we are not firing them. People are quitting. You know, the responsibility is clear. We said it. If you hire and you get this job, you have to be vaccinated. If you are not following the rules, you are making that decision. You're making the decision that you're not going to follow the rules of getting vaccinated. And that's a decision that they're making. I want them to stay. I want them to be employees of the city, but they have to follow the rules that were put in place before my administration. I would do a disservice to those who follow the rules if we don't have a clear direction. Because what happened with when the next strand comes out? Then we're iffy. We're saying you should or you shouldn't. No, we have to be very clear. People must be vaccinated if they are New York City employees. Everyone understood that, and we have to follow that. Okay.